Good afternoon, this is Dr. Samir here and I'm going to talk today about scope of homeopathy in autism. Now let us look at what is autism. It is a pervasive mental disorder appearing in the first 3 years of life. Intense developmental disability characterized by markedly abnormal or impaired development in social interactions and communications. It is also associated with stereotyped behavior, purposeless motions, hyperactivity with lack of interest. Now, what are the causes of autism? It requires two factors. First is a genetic predisposition to autism, and second is a toxic overload and other stresses that act as a trigger for autism, typical multiple vaccinations. So, genetic predisposition plus environmental toxins or insult is equal to autism. What are the early signs? Onset within 3 years of life. Child looks at one object constantly, does not give a eye to eye contact on calling, does not respond to his name, does not give a social smile, does not recognize his family members, and he is busy in his own world. How to diagnose autism? Firstly, there are behavioral issues such as hyperactivity, temper tantrums, poor attention span, decreased concentration, and poor focusing. Secondly, there are speech, language, and communication issues. Thirdly, social skills impairment such as poor eye to eye contact and poor interaction with peers. How do you diagnose autism? After establishing the clinical diagnosis, we can utilize specialized tests like CARS. CARS means Childhood Autism Rating Scale, through which autism is classified into non-autistic, mild, moderate, severe categories. Another test is Autism Testing Evaluation Criteria, popularly known as ATIC. And lastly, VSMS, which tells us the social quotient of the child. Is autism curable? What is the prognosis of autism? The future of autistic child depends upon many things. The degree of mental retardation along with autism. Autistic children with normal intellectual functioning may be able to adjust with society far better than children below average IQ. What is the degree of autism like mild, moderate, severe? How early the disorder is diagnosed and what are the therapeutic interventions received by the child? Whether proper diet is followed or not? How early the homeopathic medications have been started? Can autistic children be educated and how is it done? Yes, autistic children can be educated using advanced technique like applied behavior analysis. Parental guidance, counseling, speech therapy, sensory integration treatment, they are essential. What is the role of homeopathy in treatment of autism? Homeopathic medicines do not merely act on any particular organ of an individual, but it has a much more deeper and central action, such as on the psycho-neuro-endocrine axis. Thus, it plays distinct role in reducing or eliminating autistic features. In autism, we come across impaired sensory defenses, giving rise to severe disturbances of severe sensitivity. Some children show marked degree of hypersensitivity to noise, light, touch. Some children show intense inclination for hugging and kissing, while some are averse to hugging and killing. Homeopathy works to correct this accentuated state of sensitivity, bringing about a good moderation. There is a marked impairment in processing kinesthetic and proprioceptive sensation. Homeopathic materia medica gives ample evidence of such symptomatology. When skillfully utilized, it yields marvelous results. Autistic children quite often suffer from acute fears like fear of dark, crowd, gravitational fear. Homeopathic medicines, they help remove these fears. Homeopathic medicines helps improve fine motor skills as well as perceptual difficulties. Behavioral modification through homeopathic medicines is an old, well-documented function. These tiny sweet pills work wonderfully to improve hyperactivity, temper tantrums, self-injurious behavior or destructive behavior. A harmonious coordination in a team of doctors, psychologists, educators, therapists and parents is a must in dealing with the spectrum of autism. Each discipline has its own distinct role to play. Synergy results in the best results. What improvement we should expect after homeopathy? Many parents they ask me that after I give homeopathy, what are the results that I'll see? So I tell them that when a child starts responding to homeopathic medications, improvement is seen first at the general level. The child starts getting calmer, improvement is seen in his sleep, appetite and general health. Next, improvement in the behavior. Reduction is seen in hyperactivity, restlessness, tantrums, violence, etc. Then there is improvement in eye contact and ability to respond. Further, we see changes in communication skills. He starts indicating and subsequently starts developing ability to speak words. Echolalia also improves too, but this may take a long time. Obsessive behavior takes a very long time to improve. Child starts showing improved general resistance. This is because homeopathic medicines they act as immunomodulators. In my practice, I have seen three types of autism. First is a hyperactive kinetic, that is the restless children. Second is the regressive autism, where eating and licking dirt, involuntary urine and stools, no eye to eye contact, aggressive, screaming, involuntary laughing children. And the third type which I have seen is self-destructive or self-injurious type. In these three types of autism, I have seen that tarantula works best with autism with high kinetic energy, with marked relief from music. While Homeopathy is a remedy for regressive type of autism, where there are a lot of regressive features and violence. While a third, which is self-injurious behavior, we have a drug called hydrophobinum or lysine. My findings with autism are that there are three types of remedies during the course of management. First are the phase remedies, second are the chronic constitution, and third are the nosodes, which have to be used as intercurrent in case of a miasmatic block. Often cure takes place by use of proper sequence of remedies. Some phase remedies are stramonium, hyoscyamus, tarantula, bufo, belladonna, senna, anacardium, veratrum. The chronic remedies are baryta, calcarea phos, calcarea iode, calcarea silicata, natrum mure, ferrum nux vomica. Even carcinosin, but carcinosin comes in the group of nosodes, tuberculinum, carcinosin and medorinum. If the remedy covers the entire pattern of learning disorder in particular, the remedy has a greater depth of similarity. For example, in this case, specific to child's learning problem was a mistake she made in spelling. Here she omitted the last letter of the word while writing. The rubric is so specific in our materia medica, but nonetheless very accurate. Mind mistakes make writing in omitting letters final letter. And there are three drugs called hypericum, laccaninum and melilocus. Autism is common in first 3 years of life. Let's summarize now. It is more common in boys than girls, not restricted to any class or caste or creed. Autistic children usually have a normal milestone, but some event which can be the cause of regression. This is where homeopathy plays a very, very important role. Autism has usually its roots in mother's pregnancy history. Many cases are detected by school children, school teachers who notice some abnormal behavior in the children like no eye contact, poor mixing up, not handling toys, not responding to names. Severity of the disease also determines the scope and prognosis of every case. The lower the scores on autistic scales, milder the grade of autism, better intellectual functioning indicate better prognosis and early regressal of symptoms. So remember, today's session tells you that autism is curable. They are always unique, totally interested, but sometimes mysterious. And that's what our autistic children are. If you have any queries, please don't hesitate to contact me on Dr. Samir Chaukkar at gmail.com, on 98921 66616 or 87677 02498. Dr. Samir from Holistic Health Solutions taking your leave. Thank you.